Well, welcome back to the Federal Retirement Show. I'm your host, Val Majewski with American Benefits Exchange. Really appreciate you, the federal employee, taking time out of your busy schedule, because I know you've got a lot to do, a lot going on, to view our content, to visit this radio show podcast, the Federal Retirement Show, because the goal of this show, if you're not familiar, is for us to give out accurate and honest information when it comes to your benefits and retirement scenarios. There's a lot of things that we believe you need to know, and that's why we do what we do. We want to provide you with this information so you can make the best decisions. If there are topics or things that you want to hear, please reach out to us. If there are questions that you have that are very unique and specific, reach out to us. How can you do that? You can go to our website, www.federalretirementshow.com, fill out the form. We will be in touch with you. One of our representatives across the country, if it's not me specifically, will be reaching out to get you the information that you're looking for, answer all your questions, just to make sure you get some peace of mind, because I know this can be daunting. There's a lot of information out there, a lot of things that you need to know. One of our biggest things, you don't know what it is you don't know. We want to fill in those blanks. Now, speaking of not knowing what you don't know, let's dive into today's content and talk about Medicare. First of all, what is Medicare? We're going to see and answer this question. Do you need to elect option or Part B? So let's dive into today's information as we discuss Medicare and your federal employee health benefits. Now, this question or this topic comes from one of our reps across the country had a question from one of the scenarios that they were working. And the federal employee was asking about their FEHB, their federal employee health benefits, and their Medicare coverage when they're turning 65 and eligible to get Medicare, and how it works if they need to elect option, or say option B, Part B with Medicare. Option B is with your FEHB, right? But Part B with Medicare. And is it a good situation for them? Should they do that? Now, we can't just give a blanket statement, whether you should or shouldn't, but we're going to dive into it a little bit. Now, we're just going to scratch the surface, because Medicare is its own animal, right? When it comes to deciding when to take it and all that it encompasses. I mean, for those of you that have turned 65, or those of you that are turning 65 in the near future, you are getting bombarded with emails, with printed mail, all this different marketing material that companies are sending you talking about Medicare. And if you're not used to reading all of this, or you can't make dollars and cents out of it, it can be extremely confusing. And you may not understand what Medicare is, what it covers, what it doesn't cover, how it works, how things change over time, because it's a lot to digest. And you've got a life, you've got work that you're still doing, or you're in retirement traveling or visiting grandkids or working in retirement, whatever it might be. And you don't have the time and effort to digest and try to understand what Medicare is, what it covers, what it doesn't cover, et cetera, et cetera, et cetera. So we're going to try and make this as simple as possible. And I'm going to go through it from a very high level, but then we'll try to answer the question of, do you need to elect Part B, as this federal employee was asking? And this is a question we get asked a lot. So we've covered Medicare before and how it works with your federal employee health benefits. In previous episodes, you can go and find that wherever you want to view not webinars, but podcasts, radio shows. You can view all of that content, especially at our website, checking out our previous episodes. But when it comes to Medicare and federal employee health benefits, we want to talk about and how they coordinate, how they work together, and just what exactly Medicare is. So let's dive into that first. What is Medicare? Now, it says health insurance for those that are 65 and older. And I put typically, because there are ways people can get Medicare prior to the age of 65. Maybe they're on disability or whatever it might be. They may get Medicare early, but just normally for those that are 65 and older, this is government-run healthcare, essentially, stuff that you've been paying for your entire working career. So health insurance for those that are 65 and older. There are various parts of Medicare, and all the different parts have different coverages that they participate in, right? Or that they help out with. And there's generally 4 parts to Medicare, 4 parts. There's Part A, which is covers hospitals. And this is just in general blanket, again, high level terms. Part A covers hospitals. So if you have a hospital stay and you're on Medicare and you have Part A, uh, this part will pay, or portion will pay for your medical stay or your hospital stay. Part A is also what you automatically get. I say automatically, you generally are going to elect this to start Medicare at age 65. Most start right on the nose at 65. Part A is something that you can get right away at age 65. This is something that you've also been paying for your entire working career. So if you look at, you pay FICA taxes, right? You pay for Social Security and Medicare. You also pay for um, some income taxes, things like that. But your Social Security and Medicare, which is generally 7.65% of each paycheck, 6.2 of which goes to Social Security, you are paying for Medicare. You're paying for Medicare. We'll go over costs here on the next slide, but Part A is what you've been paying for your entire working career. That's the money you've been putting in. Part B covers doctors and specialists. So hospitals with Part A, doctors and specialists Part B. Part C of Medicare is also known as Medicare Advantage, right? Not necessarily known as Part C, but Medicare Advantage. This is not something we're going to really talk about today because most federal employees are not going to be in the need for a Medicare Advantage plan, but that's also known as Part C of Medicare. Part D of Medicare is prescription drug plans. And most federal employees are not going to need Part D either because their FEHB has prescription drug coverage, unless there is some drug on a formulary where a Part D plan makes more sense and you can get it at a cheaper cost. But in most cases, your FEHB will cover your prescription drug plan, prescription drug needs, and the cost will be pretty cheap compared to other Part D plans. But it's always good to take a look if you're eligible for that and see if you can save some money. So FEHB and Medicare, how do they work together? Okay, how do they work together? Well, they coordinate. So this is for, let's just say, federal employees that are either working when you turn 65 or are retired when you turn 65. Because Medicare, just typically, as I said, is not for those that are under 65. It's something that you're going to get and you're entitled to start, able to start once you turn 65. While you're working, if you're still working as a federal employee and you have a federal employee health benefit plan, your FEHB will be your primary while you're working. And if you turn 65 while you're working, Medicare will then be your secondary. Okay? Medicare will be your secondary. Once you're retired, it flips. It flips. That's when Medicare will be your primary and your FEHB will be your secondary. Now, FEHB, your federal employee health benefits, and Medicare, no matter which one's primary or secondary, they coordinate to pay their particular part of a claim. And hopefully, if you have both of them working together, it will limit your out-of-pocket costs. Now, there is something else with Medicare that I did not mention because Medicare doesn't cover everything, right? This is for, let's say, the private sector. If somebody in the private sector were to have Medicare, just Medicare Part A and Part B, typically Medicare covers about 80%. 80% of covered expenses is what Medicare will cover. The additional 20% is left to you. Now, in a traditional sense, that's where people either say, well, I don't want to just cover 80%. I want to try to cover as much as I can. So somebody would get a Medigap or a Medicare supplement policy to go in and cover those gaps, or as many of those gaps as they possibly can. Your federal employee health plan is essentially your Medigap plan in retirement. It acts like your Medicare supplement plan to fill in most of the gaps. So if you had a full amount of coverage, Medicare Parts A and B, and your FEHB, your out-of-pocket expenses should be very limited. Should be very limited. I can't guarantee it's going to cover everything, right? Because not everything is essentially covered by all, but it should limit your out-of-pocket expenses if you had everything. Parts A and B, how this work, right? I said Part A is something that you've been paying for while you're working. Okay, 1.65%. 1.45% comes out of your paycheck to go towards Medicare. So you're going towards, you are paying for it. Now they say, hey, Part A is free. It's not free because you've been paying for it. So I don't want to get it mixed up like, oh yeah, you get Part A for free. No, you've been paying for it. Okay, you've been paying for it. Money's coming out of every paycheck. As I said, 6.2 to Social Security, 1.45 is going out to Medicare. um, you've been paying for it and you get Part A. You have the ability to elect Part A when you turn 65, and there is no more cost for that. Okay, no more cost coming out of a paycheck going towards Medicare. So Part A, you can elect when you first get hired, and when you turn 65. I apologize, and you can get your Medicare card, have Part A. And if you're still working, great. They're going to coordinate with each other. Said FEHB is going to be your primary, Part A of Medicare is going to be your secondary. You can elect now. Part B is optional, and this is the question that came up. So I've done all this kind of foundational work on a very high level, right? We're just kind of scratching the surface on Medicare, but Part B is something that you can elect. This is an optional coverage. You do not have to get it. I would highly recommend, if you're eligible to get Part A, as soon as you turn 65, get it, right? It's only going to help out. Unless there's actually one reason why you wouldn't get it. I'm going to pause for a second. If you are using an HSA, if you're using an HSA plan through the government, all right, or if you can't have or utilize an HSA and have Medicare at the same time. So if that's the case, then maybe you put off using or electing Medicare when you turn 65. Most federal employees that I talk to are not in this situation. So you're going to elect, in general, Part A when you first turn 65. You're going to turn that on. Part A is provided, again, at zero cost. You don't have to pay any more for it. If you do elect Part B, now Part B is optional. You do not have to choose to get Part B. You don't have to get it at any time. But as I said, Part B will cover doctors and specialists, outpatient services, things like that. And this is an optional coverage. There is a cost, though, for Part B. Now, the current cost is $174.70 per month. That is the starting cost for that. For those that make too much money, it can be significantly higher than this. So based on your income, and there's a 2-year look back on the income, we can talk about more of this. This is called IRMA, but we can look at, and we've had episodes where we've talked about this, but you want to make sure that you're making the right decision when it comes to Part B. Okay. Part B, again, is an election. It's optional. You don't have to get it ever. You can just have Part A and stick with your FEHB in retirement, and maybe you're good. And maybe you're used to your federal employee health benefits covering most of your medical expenses, and there's no need to pay extra money for Part B because you've really got limited out-of-pocket expenses as it is. Part B will just be kind of a wrapper around the whole thing where you really will not have many or much out-of-pocket costs if you've got all of it. You just got to pay for the premium. So it's more like you're prepaying for that additional health care. At $174.70 a month currently, and that cost has generally gone up every single year, at least since I've been in this industry helping federal employees and talking about health insurance. But again, I want to reiterate that it's an election. You don't have to take it. Now, once you're eligible to take it, and if you don't take it, you can be penalized for that. You'll get a surcharge or a penalty assessed to your cost of Part B if you do elect it down the road. Now, I will say this. If a federal employee is 65 and still working, your clock does not start for Part B until you retire. Let's say you're already retired and you hit 65. Yeah, you get Part A and you can elect Part B. If you choose not to get Part B initially, and then down the road you decide to get it, well, you're going to have a little extra surcharge added to your cost because you didn't get it right away when you're eligible to do so. So your clock does not start until you're either retired and then turn 65, or if you're still working when you turn 65, once you retire, that's when that clock starts. Every year you wait is you're going to add additional surcharge to that. Now, Part B costs typically are deducted from Social Security payments. If you're still working, you most likely are not yet getting a Social Security check. So you will have to pay directly for your Part B cost. Once you start collecting Social Security, Part B will be deducted from your Social Security payments. So if we're kind of summarizing all of this, right? FEHB and Medicare, they coordinate together. That's not something you have to worry about. They work well together. They'll coordinate. So whatever you've got and whatever needs to be covered, they will coordinate together. Again, reminder, while you're working, FEHB is your primary, Medicare is your secondary. Once you're retired, that flips. Medicare becomes your primary, your FEHB is your secondary. Option Part A, you need to elect, I would highly recommend electing as soon as you turn 65, unless that interesting circumstance that I mentioned earlier. That's rare that I see, but it does happen. And then Part B is optional. Part B is optional. Understand there's an additional cost for that. It could complete your health plan and really limit your out-of-pocket costs if you go to the doctor often. If you don't, if FEHB covers everything along with Medicare Part A and you're fine, then you're not going to be penalized for not taking it if you never take it. But understand that if you do elect to take it down the road, you'll have a penalty, a surcharge that you are paying on top of the regular Part B premium. So the question goes back to, do you need to elect Part B? Is this a necessity? And this was more of the question. Do you need to? In the general sense, the answer is no. You do not need to. It is not mandatory for you to take Part B in order to keep your FEHB. It is not mandatory. Now, there's a certain plan out there that's, if you're a postal employee, there's a little bit of a difference there. Okay. Some of the new things they're coming out with, depending on when you're watching this, they are requiring you to take both Part A and Part B in order to keep it in retirement. But just in general, I said I'm going high level here. In general, no, you do not need to take Part B of Medicare. Should you? That depends on a number of circumstances. I cannot, in a blanket statement, give any recommendation, say yes or no. It depends upon your circumstances. It depends upon how often you go to the doctor. What are your medical expenses like? You know, would prepaying $174.70 a month help on the back end and eliminate some of those extra out-of-pocket costs? If the money makes sense, if you're going to pay more by not taking Part B than you would by taking Part B, then why would you not take it, right? If it's going to limit your cost by taking Part B. So just understand everybody's circumstances, everybody's situations, things that they're going to the doctor for, medical expenses, whatever. All those things are different from person to person, family to family. If you want to dive a little deeper into your situation, that's why I highly recommend go to our website, federalretirementshow.com, fill out the form, request some information. We'll do a full benefits review, but we'll answer your specific questions because we want to get you the information that you need so you can make the best decisions once you're in retirement or nearing retirement or planning for retirement. It's not just about Medicare, but today we're talking about Medicare and your health benefits. So take a look at your situation, see if it's something that you feel like you're leaning towards or not leaning towards, but know all the variables, know all the information. Again, no, you do not 100% need to, but should you? Maybe. You know, speak with an expert, speak with somebody that can analyze your situation, that is an expert in federal benefits and can give you some deeper dive into this information. So reach out to us. Again, go to our website, fill out the form, be happy to help in any way that we can. Well, I hope you appreciated today's episode. If you're interested again in more, go to our website, reach out to us. We'll contact you individually and make sure that we go over your personal situation, point you in the right direction. Again, my name is Val Majewski with American Benefits Exchange. It's a pleasure, as always, to come to you here through the Federal Retirement Show. If there are any topics or things that you want to hear, as I said earlier, we want to hear from you. If not, we're just going to keep pushing out the information that we believe you need to know. But we'd love to hear specifically if there are any topics that we have not discussed in our 100+ episodes. We want to make sure we're giving you the information that you all need, not just that we think you need, but we want to make sure it's specific to what you all need. So thank you so much for your time and attention. Look forward to seeing you on a future episode.